Frozen shoulder adhesive capsulitis. Have you ever tried to reach for something on a shelf, put on a shirt, or comb your hair, only to feel a sharp pain in your shoulder? Maybe you've noticed that your shoulder doesn't move the way it used to. At first, it may seem like a minor problem. You might think it's just muscle soreness or that it will go away on its own. But what if the pain keeps getting worse? What if, over time, your shoulder becomes so stiff that even simple daily activities become difficult? If this sounds familiar, you may be experiencing a condition known as frozen shoulder. Hello everyone, I'm Dr. Ayman Noor, physiotherapist. In today's lesson, we will discuss everything you need to know about frozen shoulder, also called adhesive capsulitis. What is frozen shoulder? Frozen shoulder is a condition that causes pain, stiffness, and reduced movement in the shoulder joint. The condition develops gradually and often becomes worse over time before eventually improving. Many patients describe the feeling as if their shoulder has become locked or stuck. Movements that were once simple become difficult and painful. Activities such as reaching overhead, wearing clothes, combing hair, driving, and sleeping on the affected side can become extremely challenging. Frozen shoulder usually affects one shoulder, although in some cases both shoulders may be involved. The condition most commonly occurs between the ages of 40 and 60 years and affects women more frequently than men. Types of frozen shoulder. Frozen shoulder can be divided into two categories, primary and secondary. Primary frozen shoulder occurs without any obvious cause and is often called idiopathic frozen shoulder. Secondary frozen shoulder develops because of another underlying condition or event. Causes and risk factors. One of the most important causes is prolonged shoulder immobilization. This can happen after a fracture, shoulder surgery, rotator cuff injury, or severe shoulder sprain. Other important risk factors include diabetes, thyroid disorders, stroke, Parkinson's disease, shoulder injuries, complex regional pain syndrome, and some medical conditions such as cancer. Understanding the shoulder joint. To understand frozen shoulder, we first need to understand a little anatomy. The shoulder joint is surrounded by a structure called the joint capsule. This capsule is made of connective tissue and provides stability while allowing a wide range of movement. A healthy shoulder capsule is flexible and allows the shoulder to move freely. In frozen shoulder, the capsule becomes inflamed. Over time, this inflammation leads to thickening and tightening of the capsule. As the capsule becomes tighter, shoulder movement becomes increasingly restricted. What happens inside the shoulder? The process usually begins with inflammation. Inflammation causes pain. As the inflammation continues, scar-like tissue begins to form. This tissue thickens the capsule and makes it less flexible. The shoulder gradually loses its normal movement and becomes increasingly stiff. Signs and symptoms. The two most important symptoms are pain and stiffness. Pain may begin gradually and become worse over time. Patients often feel pain around the outer shoulder, upper arm, or deep within the shoulder joint. The pain may become worse at night and can affect sleep. As the condition progresses, stiffness becomes more noticeable. Patients may struggle to reach overhead, reach behind their back, lift objects, dress independently, or perform household tasks. A hallmark sign of frozen shoulder is limited external rotation, meaning turning the arm outward becomes particularly difficult. The 3 stages of frozen shoulder. Stage 1, freezing phase. This is the painful stage. Pain gradually increases over several months. The shoulder becomes uncomfortable during daily activities. Patients begin avoiding movement because it hurts. This phase commonly lasts between 6 and 9 months. Stage 2, frozen phase. In this stage, stiffness becomes the major problem. Pain may decrease somewhat, but shoulder movement becomes severely restricted. Patients often notice that they cannot raise their arm normally. This stage may last from 4 to 20 months. Stage 3, thawing phase. This is the recovery stage. The shoulder gradually begins to regain mobility. Pain continues to decrease and movement slowly improves. Recovery can be frustratingly slow, but progress does occur. How is frozen shoulder diagnosed? Diagnosis is usually based on medical history, symptoms, and physical examination. A healthcare professional will assess pain levels, range of motion, and functional limitations. Imaging tests such as X-rays, ultrasound, or MRI may sometimes be requested to rule out other shoulder conditions. Treatment of frozen shoulder. The good news is that frozen shoulder often improves with time. However, treatment is important because it can reduce pain, improve function, and speed recovery. Pain management. Reducing pain is an important first step. Pain control helps patients move the shoulder more comfortably. Doctors may recommend anti-inflammatory medications or other pain relief strategies depending on the patient's condition. Corticosteroid injections. In some cases, corticosteroid injections may be used. These injections help reduce inflammation and pain and are often most effective during the early painful stage. Physiotherapy. Physiotherapy plays a major role in treatment. The goals include reducing pain, improving mobility, restoring function, and preventing further stiffness. Treatment may include passive and active range of motion exercises, stretching, joint mobilization techniques, and home exercise programs. Why movement is important. One of the biggest mistakes patients make is completely avoiding shoulder movement. Excessive immobilization often makes the condition worse. Movement helps maintain flexibility, encourages circulation, and prevents further tightening of the joint capsule. Surgical options. Most patients recover without surgery. However, surgery may be considered when conservative treatment fails. These options include manipulation under anesthesia and arthroscopic capsular release. Recovery expectations. Recovery requires patience, early diagnosis, appropriate pain management, consistent physiotherapy, regular exercise, and persistence are key factors for success. Frozen shoulder is a painful and frustrating condition, but it is treatable. If you are experiencing shoulder pain, stiffness, or difficulty moving your arm, do not ignore the symptoms. Seek professional advice, stay active within your limits, and follow a structured rehabilitation program. I'm Dr. Ayman Noor, physiotherapist. Thank you for watching. And don't forget to follow for more physiotherapy and rehabilitation education.